So with that, I'm so excited to welcome you here today for the kickoff. The official kickoff, I suppose, of the Coalition Checkup project. Certainly the survey, the data collection was really the step one. But this is really where then we connect with you and get you the data. And so I'm just so excited to have all of you guys here today and to get moving. And so with that, I think, Dan, you can go ahead to the next slide. And so we thought this webinar would be a good idea to just orient people to what's coming up and what this project is going to look like. And feel free to stop and ask any questions at the end or any questions throughout, but we're also happy to stay on at the end if there's something in particular you want to discuss. We thought first here we'd go ahead and just do a little bit of an overview of the different names and who everybody is. You guys have probably received a lot of emails from different people over the last month or two. And then from here, we'll move into looking at the logic model, talking a little bit about the why of the project. Then we'll actually dive into that feedback summary a little bit, and you guys can see and learn how it works. We'll also be talking about timeline a little bit and some resources as well. With that, what are your questions before we jump on in here? Any questions, comments? Great. So let's see here. Actually, Dan, can you go back up one more? So just to go ahead and touch on this for a minute. So I'm Sarah Chilenski, although I think I've met all of you through this process already, but just in case, I'm the project lead at Penn State, and Lewis Brown is a partner in this work, and he's actually out of the University of Texas. We have a number of people just kind of providing some support along the way. The name you're probably most familiar with is Yvonne at this point, other than Dan and Melissa, of course, but Yvonne, she also works with Lewis outside of Texas, or in Texas, and has been helping a lot with some data. And of course, our technical assistance providers are Megan, Melissa, Jeff, and Dan. Dan is going to be the person you're going to hear from the most. He's been assigned to all of you. And if you have any questions about the project or your feedback summary or whatever, he's the person you can reach out to. And I think contact information is at the end of the slide, but certainly we can also put that in the chat. And then although through the data collection project or part of the project, you also heard through that step one, probably from Diana and Mindy. And so helping with interviews and get people scheduled and that kind of thing. So, so just wanted to kind of acquaint folks to the different roles involved in this project. But why don't we go ahead and turn to the logic model? And so here we thought we'd go ahead and just pause for a moment and talk about the why of the project. In some ways, this is maybe taking a step backwards. You know, during the recruitment phase of the project, we talked a lot about, well, what it is and the process and what coalitions would do and responsibilities and that kind of thing, that we didn't really talk a lot about the why. And so we wanted to go ahead and take a moment to reflect on that. Like, why are we doing this? What is this about? And so to start off, you know, what we've learned over time about how coalitions, we've learned quite a bit over time about how coalitions can support youth health and development in communities. And so we've learned really, and Dan, if you can use your cursor a little bit, like, so we've learned that the resources that coalitions have access to or bring into or develop in their coalitions can affect how that coalition operates, or in other words, how the coalition functions. And so then from there, we can think about how the coalition functions, or its processes, its internal workings, communication strategies, how things operate internally, and its structure as well. So how the coalition functions then can affect the community, the quality of the community improvement activities. And so, thinking about those, the community improvement activities is kind of a big phrase to think about those programs and activities that your coalition is bringing into the community to support your youth and families. And then, of course, it's the quality of those activities, which then would go to support positive youth outcomes and also improve family relationships, if that's something your coalition is interested in. And so, it's how this is all connected, starting with the resources to coalition functioning to activities that gets us to outcomes for youth and families. And so we've also learned from both research and our practical experience here that technical assistance or support along this way, this is very, I don't have to tell you, like, this is a very complicated and complex process. And support through that process, or what we often refer to as technical assistance, can be helpful and important. What we don't know is, what is it about technical assistance or support that matters? We also know that technical assistance is often not as readily available for coalitions once they get into doing this work for a number of years. It's also not usually as individualized either. And so that's what this project is focused on. We're trying to look at coalitions that have been, and work with coalitions that have been doing this for quite a while, and lend some individualized support through that feedback summary. And so this is why NIDA, the National Institute of Drug Abuse, was interested in funding this project. And so they recognize the importance of community coalitions in supporting youth health and development. And they also want to know, how can we better support community coalitions to do their work and their own work in supporting their own communities. And the way to do this then was to both go ahead and fund the intervention resources, and then also a research study, research part of the project. So we can have a sense at the end, is this worth it? And so all that said, we did successfully recruit 68 coalitions between the states of both Pennsylvania and Missouri. We've divided all of those coalitions into the two groups randomly. So every coalition had an equal chance of being either in the full coalition checkup group or the streamlined group. And your coalition ended up, all of your coalitions ended up in the streamlined coalition checkup group, which is a great place to be. And quite simply, we won't be able to quantify what it is about TA that is so important without your participation. And so, and I can't really emphasize that enough. And so what does being in the Streamlined Coalition Checkup project really mean? And so it means you're still eligible for all the technical assistance that you normally would have been eligible for. So any connection you've had with CADCA, any connections that you've had with the Missouri Regional Prevention Centers, the statewide conference, or any resources that you've always had access to, you are still access to. You still have access to. And you're also eligible then for some special things that the Coalition Checkup is bringing. And so that is this feedback summary that I think actually all of you should have received. Well, actually you guys are going to be receiving yours. Well, everybody in this group should have theirs by the end of the week. I think some of them might have been sent already, but I think a couple of them, we were finishing final touches last week. So those should all be out this week. And then a couple months later, after you've had a chance to review that feedback summary, we'll go ahead and send some action planning materials your way as well. And so it's good to see you in the corner. So, so there we have it. I guess for now, if I'm going to kick it over to Melissa. Oh, we still have a timeline, and then I'll kick it over to Melissa. So, So here, we've already talked about receiving those feedback summaries. If you would like a printed copy, I mean, as you'll see as Melissa takes us through it, the document has really been built to work very well on a computer screen. But that said, if you would like a printed copy, we're happy to print one and mail one to you. Sometimes coalition leaders, like having something to touch and look through. So just let us know. And then, so then the action planning materials will be coming this fall, September, October. And certainly you can be in touch with us with questions, comments at any time. And then we would be looking for surveys to happen again, kind of early spring in March or possibly April. So that's kind of looking at the next year in advance. And so for now, then I'm going to go ahead and kick it over to Melissa, and she's going to walk us through how the report actually works.
Thanks, Sarah. So I'm going to go ahead and share my screen here. Yeah, Dan, if you would, thank you. Perfect. So Sarah mentioned that most of you probably already received this. If not, you will be getting it relatively soon. And so did that pop up, the feedback summary? Okay. For some reason, it's saying my screen sharing is paused, but you guys can see that. So I guess we're good. All right. So this is what the cover of your feedback summary will look like. And then I'm just going to walk you through the navigation tools that are embedded in it, and you'll see why it really is created to be used on the computer. Though, again, like Sarah said, if you need a print copy, that's certainly not a problem to get that to you. So the very first page here is the table of contents. And you'll see that there's a lot of hyperlinks in this document. So really, any page that you want to go to, obviously you just click on the link. And you'll see that it really resembles that logic model that Sarah was just introducing.
Melissa, actually, yes. It's not advancing.
Okay.
We're not saying where you're going. Yeah, I would just.
Let's see if I can try that again then.
Yeah.
Are we on the table of contents?
Yes.
Okay, great. Yeah, that was weird that it was saying it was paused. So hopefully that fixed this. So yeah, you can see that it really goes along with the logic model. So we have resources, coalition functioning, and then community improvement activities. And it's divided into 5 dashboards among those 3 sections. And so let's go ahead and look at that resources dashboard. This really gives you a broad picture about how your coalition is doing as far as resources go. You'll see up here in the corner is a key. This dark teal is an area of strength. The lighter teal is a neutral or average metric. And then this coral or orange color is a potential area for growth. So from these dashboards, and like I said, there's 5 dashboards, you can really see at a glance how your coalition's doing, where your strengths lie, and where there might be some options for working towards some growth in some areas. So another thing I want to point out is that each of the dashboards are divided into categories, which is in this gray box. And then below the categories are characteristics. And as we go through the report, you'll see that we really can get a lot of information about those different characteristics. And I'm just going to show you quickly how you can take a look at any of them. So, we have some tables, we have some graphs. One thing I want to point out on this page is this diamond here is the mean for all of the projects, all of the coalitions who are participating in the project. Sarah just mentioned it's 68. So, you don't want to read too much into that, but it does give you an idea about where you're at in comparison to the other coalitions who are participating. And then one other thing that I wanted to show you is if you are on a page that has these hyperlinks underneath the characteristic, you can always click on that and get even more information about that specific topic. So that's, that's not available for every single characteristic, but it is for quite a few of them, and you'll know because of the hyperlink there. And then just real quick, a couple navigation tools. When there's this arrow at the top, you can click on that and it will take you back to where you were. If there's this gear on the top, you can click on that and it takes you back to the dashboard. And then you can also jump between dashboards or go back to the table of contents. And I know that's a lot, but I want to assure you that since this is in a PDF format, you really can't mess it up. So, when you get this report, just go ahead and start clicking. You're not going to reorganize anything. You're not going to delete anything. Really just start clicking around and see what you can find. And of course, Dan's always available to answer any questions that you have about the report then. So what questions do you guys have about navigating before I pass this over to Dan? No? All right. Well, thanks so much.
And actually, before you jump in here, I just wanted to mention and emphasize that this feedback summary is yours. It's your data and it's your summary. And we really do hope it is useful for you. And so, once we send it to you, it's up to you to decide how to use it and who to share it with. No, but we're not going to share it with anybody else or anything like that. The data is really yours and we hope it can be helpful. So, okay, Dan, go ahead.
All right, so I want to start off by saying thank you, and I'm excited to work with you all. Having worked for Penn State for 5 years and now finally working with people that are like right across a river from me. I live in Illinois, but just east of St. Louis. So you all are very close to me and I'm excited about that. Same time zone, yay. So I'm going to go through a few resources, and there will be many more resources available to you in the near future as we get further into the action planning. But some of the ones, many of them you've probably heard of before, but the first one we actually listed here is actually the evidence-based prevention and intervention support. That's a Penn State resource, and I'm happy to share the website information on any of these or go into some details, but I just want to loosely cover them for now until we get later on into the action planning. Then there's the ACT-MO, Substance Use Prevention Conference. That website it looks like it's a little bit lagging as far as having been updated, but many of the resources are still there and available for you. I just can't speak to the conference itself. Then there's the Missouri Suicide Prevention Conference, which, if memory serves, is actually Wednesday is when it begins. But many of those resources are available to you as well. We have the Mid-America Prevention Technology Transfer Center, which is, again, a website that just has immense numbers of resources available to you all. The Missouri Institute of Mental Health, and then the Missouri Department of Mental Health as well. Each of them have a website that has significant amount of information available for grant writing, resources for prevention programs. The Evidence-Based Prevention and Intervention Support website is a Penn State resource, but one of the great things about that is that it has a significant number of implementation and evaluation tools available to it, to you. Even though y'all are in Missouri and that's from Penn State, it's still absolutely applicable and available to you anytime you need. And again, if you aren't familiar with one of these, please just reach out and I'll connect you to them and try to help you out in any way that I can so that those resources are available for you. Are there any questions about resources, or is this pretty much information you already had available?
I'll just add that certainly the regional prevention centers for the Missouri Regional Prevention Centers are also, which I think most of you are pretty well tapped into them, but certainly that's another really good resource for prevention in Missouri as well. Okay.
Okay. If there's no more questions, then Sarah, I'll hand it back over to you.
Okay. Well, and so I think, yeah, we just wanted to do a little bit of a connection, little bit of a hello, a kind of a preview of how you can use that feedback summary online. You know, there are some instructions, kind of the first couple pages. So, but you know, it wouldn't necessarily be apparent that we have all those little tools and hyperlinks connected into all those little icons and such. So I wanted to make sure you could see it and use that feedback summary pretty well. And I think with that, you know, one thing I neglected to do, I deeply apologize because I have met all of you before, but if you wouldn't mind, just for Dan and Melissa, because they were both kind of involved on and off with recruiting, if we could just go around and say, introduce yourselves and which coalition you're with and maybe which county you're in, that would just be nice. We can kind of finish up that way. And yeah, that'd be great. I don't know, Andrea, if you wouldn't mind going first.
So I'm Andrea Holloway. I'm the executive director here at Council for Drug-Free Youth. And then I have Tiara Safir, who's our project coordinator. And we are in mainly Cole County, Missouri.
Great, thanks.
Yep.
How about Teresa?
Hi, I'm Teresa Daly. So I'm glad to hear Cole County. I know where that is, west of me down Highway 70. I am with BJC Health Systems, specifically representing our 2 hospitals in St. Charles County.
Great. Thanks, Teresa. It's great to see you two today. And Kat?
Hi, everybody. I'm Kat Barrow, and I am here representing Kearney Holt Can, Community Acting Now. We are a small coalition working primarily out of Kearney, Missouri, in Clay County.
Great. Great. Thanks. Thanks so much. And then there's a couple more of the Streamlined coalitions that were unable to make it today. So with that, then, yeah, we're happy to hang on for a few minutes if anybody has any questions. And we'll go ahead and get the recording out to you and everyone else in the Streamlined group later. Well, as soon as it's available, hopefully later today. But thank you so much for coming today.